Hi, everybody. It's good to be with everybody. Um, I am going to get right into it on the um, on the Department of Labor and what they've been doing with the Families First Coronavirus Response Act, and specifically over the course of the last 72 hours, we have had we have had two sets of uh, uh, frequently asked questions the Department of Labor has put out under the FFCRA, interpreting how employers are supposed to be rolling this out come April 1st. Um, a host of questions. We are up to 57 or 58 Q&As in total now, but the DOL in the last 72 hours has covered a ton of ground in regards to what how employers are supposed to interpret their various paid leave obligations under the FFCRA. So we've had answers to questions like what types of documentation are employers supposed to be accepting under the Families First Coronavirus Response Act for these various coronavirus leaves of absence. If it's a state, local, or federal quarantine or isolation order, a copy of the order would suffice per the DOL. Some kind of written documentation from a healthcare provider for a medical leave of absence would suffice per the DOL. A notice of closure, or notice of unavailability from a child's school, place of care, or child care provider would suffice. Employers are told to save this documentation because you might need it for purposes of claiming your tax credit to get paid back for whatever paid leave you're giving employees. One thing I want to note is that per the DOL, an employer has the right to ask for a note from a medical provider. Note that that's directly contrary to what the CDC is recommending. The CDC's recommended best practices is that employers not ask for medical documentation from a healthcare provider for fear of overburdening our already stressed out medical system. So DOL says you can ask for a medical note to confirm the need for this leave. The CDC says don't ask for the note, at least in the short term, because our doctors just don't have the time to provide them. Intermittent leave is available under the Act, provided that the employer and the employee asking for the intermittent leave agree upon intermittent leave. So that's leave taken in less than a day's increment. So the DOL is encouraging employers to be flexible with how they're defining an employee's unavailability to work. So if an employee, for example, needs to be off from is unavailable to work from 9 to 5, for example, but maybe can remote work, say 7 to 9, and then again from 6 until 11. They want that 9 to 5 time blocked off as unavailable so they can help their kids with their schoolwork, but they're available to work from 7 to 9 and then 6 to 11 or whatever. In that situation, an employee would be available to work and would not qualify for the paid leave. And the DOL is encouraging employers to be flexible with employees in their work schedules to allow employees what time they need during the day, and then kind of fit their work schedule around what time employees need during the workday to deal with whatever it is that they're dealing with. An employee has to be working as of April 1 to qualify for this leave. If a company closes prior to April 1, obviously there's no leave to provide. If an employee is on layoff or furlough prior to April 1, then you'd also have no obligation to provide paid leave for those employees. You cannot, obviously, I think we talked about this last time, but there's no sequencing of leave here. You can't require employees to use paid leave to have available under your policies before, during, or after this paid leave that's available under the FFCRA. Let's see. couple of other interesting points that the DOL brought up over the weekend, and then we'll get to the two big ones, which are the exemptions, which are the questions I've gotten the most. Who qualifies as a son or daughter under the Act? Under anyone under 18, it's a broad definition of son or daughter. It's a biological child, an adopted child, a foster child, a stepchild, a legal ward, or someone for whom the employee is standing in loco parentis, that is, has like financial responsibility for someone that's not otherwise their child. But the Act also says for adults over the age of 18 or age 18 or over, it covers a son or daughter that has a mental or physical disability and is incapable of self-care because of that disability. So if someone can't, the definition of a child would also cover adults with disabilities for whom that need someone other than themselves to care for them. How are we counting FMLA leave is another question I've gotten a lot from employers. That is, is the 12 weeks of FMLA, 10 of which paid under the statute, is that in addition to the 12 weeks the FMLA already makes available, or in conjunction with? The answer is it's in conjunction with. For the paid family medical leave for school closures or childcare related absences, that fits into the 12 weeks of FMLA already available to employees under the statute, which means that if an employee has, prior to April 1 in your FMLA year, has already used, let's say 6 weeks of their FMLA allotment for, let's say they had like shoulder surgery and took 6 weeks off to recover from shoulder surgery, they'd only have 6 weeks left of this paid family leave for childcare related absences under the FFCRA. And as I read the statute, the first 2 of those 6 remaining weeks would still be unpaid, and the last 4 would be paid at 2/3 the employee's regular rate, capped at $200. Per day per employee. The two big questions that we've gotten clear guidance now from the Department of Labor is the 2 exemptions under the statute. That is the exemption for healthcare providers and emergency responders, and the small employer exemption. The healthcare provider exemption, if you'd have asked me last week, I would have told you it would be a very narrow exemption, matching the definition of healthcare provider in the FMLA, since this is an amendment to the FMLA. The Department of Labor, however, applied an extraordinarily broad definition to the term healthcare provider. So it applies to, and you can deem exempt from the statute, anyone employed at any doctor's office, hospital, healthcare center, clinic, post-secondary educational institution offering healthcare instruction, any medical school, local health department or agency, nursing facility, retirement facility, nursing home, home healthcare provider, any facility that performs lab or medical testing, a pharmacy, or any similar institution, employer, or entity. Anyone that contracts with any of those institutions, anyone that provides medical services, produces medical products, or is otherwise involved in the making of coronavirus-related medical equipment, tests, drugs, vaccines, diagnostic vehicles, or treatments. In other words, according to the DOL, pretty much any employee who works for any business that touches anything to do with the healthcare industry could be considered exempt from the paid sick leave requirements of the statute. What I find interesting, though, is despite that extraordinarily broad definition, the Department of Labor notes that employers should be judicious when using the definition to exempt healthcare providers from the provisions of the FFCRA. So broad definition, but be judicious in how you apply it. It's an interesting policy choice to exempt healthcare providers, number one, and number two, to apply it as broadly as possible for a couple of reasons. Number one, and there's 2 things going on here, right? We know we need healthcare providers at work in order to help fight this virus and keep the healthcare system going. But we also know from the statistics that anywhere from 20 to 25% of healthcare providers of corona positive tests are healthcare providers. And so they're getting sick at a disproportionately high rate, but yet we need them at work in order to keep this, in order to keep the healthcare system going and running and treating the people that are sick. So the DOL has applied a very, very broad definition, and then separately says, but judiciously apply it. So I leave that for your decision, is that if you are one of these healthcare institutions listed in the Q&A, to decide how broadly you want to interpret that definition and apply it. And then the small employer exemption, which is a question I've gotten a lot from my clients. A couple of points. Number one, it only applies to the paid sick leave and paid family leave relating to school closures, childcare, place closures, and loss of or childcare provider unavailability. So it only applies to school closure leave and childcare related leave. It does not apply to an employee's own illness or an illness of a family member. Those do not qualify for the small employer exemption. So no matter your size, you still have to provide that breed of paid sick leave, the 80 hours of paid sick leave under the Act. But then separately, the DOL says, but for the buckets of leave that an employer can claim the small employer exemption, how do we define jeopardizing the viability of the business as a going concern? Because that's what an employer must show in order to claim that exemption if you're under 50 employees. And a couple of points the DOL made. Number one, it is this is a self-effectuating exemption, like the healthcare exemption. If I didn't say that before, for healthcare providers, self-effectuating. You're not applying to the DOL to say, certify us as a healthcare provider, or our employees as healthcare providers, certify us as a small employer. This is self-effectuating. An authorized officer of the business is going to make the self-determination that one of the following three criteria are met for the definition of jeopardizing the viability of the business as a going concern. Number one, the provision of paid sick leave or expanded family leave would result in the small business's expenses and financial obligations exceeding available business revenues and causing the small business to cease operating at a minimal capacity, right? You'll run out of money if you have to apply this exemption. Number two, the absence of the employee or the employees requesting paid leave or expanded family leave would entail a substantial risk to the financial health or operational capabilities of the small business because of the employee's specialized skill, knowledge in the business, or responsibilities. So key employees, someone so important to the business that if they're out of work, not working, the business will falter and close. Or number three, there is not sufficient workers who are able, willing, and qualified and who will be available at the time and place needed to perform the labor or services provided by the employee or employees requesting paid sick leave or expanded family leave, and these labor or services are needed for the small business to operate at minimal capacity. Making this paid leave available will cause so many employees to not be working that you won't be able to maintain minimal operating capacity of your business. So those are the three reasons, and you have to, and a duly authorized officer of the business has to make the determination that the business meets one of those three qualifying factors. You'll run out of money. A key employee will cause you not to be able to operate, or you'll have so many employees out that you won't be able to meet minimal operational capacity. Okay, so with that, and thanks for everybody's patience as we worked through our technical issues when we started, at 1 o'clock. There are a ton of questions that came into the chat room, and I am going to run through them as I go through. Everyone trying to tell me how I turn off screen sharing. I'm so sorry, I didn't know that ahead of time. Okay. There we go. Okay, I now have questions. For paid sick leave reason number 4, caring for an individual subject to an isolation or quarantine, can employees take this leave to care for any individual or can employer limit the category of individuals? I don't think there's any limit on it. I believe the statute speaks in terms of individuals, and if you are responsible for the care of somebody who is under some kind of isolation or quarantine related to coronavirus, then the employee would qualify for the paid sick leave. And I think this was done on purpose, not limited to, let's say, immediate family members. If you live on a street and you are responsible for looking after or peeking in on, an elderly person down the street who might not be your relative, this would qualify under that circumstance. I think it was written broadly for a reason, so that we don't have people unable to care for the people who are otherwise able to care for themselves for whatever reason are not being left without people looking in on them. So I don't believe there is any limit on the individuals, and I don't believe that employers can or should be putting limits. Let's see. Do we use the same FMLA forms as we did before? That's a great question. We have not yet seen expanded or redrafted FMLA forms for this paid family leave. It's unclear whether the DOL is going to publish the forms. We can assume that they will, but we haven't seen them yet, and I don't believe the DOL has said one way or the other whether or not they will be publishing new forms. You are certainly free to take the form that you have and add information on the form relating to the school closure or childcare related leave that you will that will qualify for this leave. One question that I haven't seen answered yet is how HRIS systems are accounting for this, or other leave management systems have, and if anyone knows, if you can kind of shout out with an answer, have HRIS or other leave management systems, has their software been updated to account for this new brand of paid leave, or either paid sick leave or paid FMLA? I haven't seen that yet, and I'm just curious how leave management, leave tracking, and other HRIS type software solutions are accounting for this new breed of leave made available by the FFCRA. Are nonprofit businesses covered under the FFCRA? They are covered. The only exception to coverage, unless you are a small employer, as we talked about, or you're an employer of healthcare providers or emergency responders, as we talked about, the only exception to coverage is if you have 500 employees or more. Otherwise, every employer is covered, including nonprofits. And I believe, although I have not received confirmation of this, I believe that the reason the payroll tax credit, or that the tax credit was written as it was, as a payroll tax credit, a credit against payroll taxes, is because of nonprofits, because nonprofits aren't paying income tax, but they are still making contributions. They're still making FICA contributions on behalf of their employees. And so I think the tax credit was written the way it was to allow for nonprofits to still claim the benefit of that tax credit, even though they are not for profit and aren't necessarily claiming income, right, against which a deduction can be taken for this, for this allotment of paid leave. Are churches covered? Again, I have not seen anything suggesting that churches or religious institutions are not covered. I think just as they are covered by the FMLA and other laws, I think churches will be covered as well. Will there be a new poster? Yes, there is a new poster. You can go to, you know what? I will do this. If you can allow me to type for 1 second. The poster, I am putting the link into the chat room. 1:27 p.m. in the chat room, you will see the link for the poster. It is available for free from the Department of Labor. It needs to be posted by April 1st. Additionally, to account for all the employees that are working remotely right now, not in the physical place of work. So we all have our bulletin boards where we post our EEO posters and our FMLA posters and our wage and hour posters and our OSHA posters and everything else. This will go alongside those posters. Additionally, however, for employees that are working remotely, you have to get the policy to them, the poster to them as well. And the Department of Labor has said that can be, believe it or not, by snail mail, although I don't recommend that. It can be by email, or if you have an intranet or other employee portal where you disseminate information to employees, you can do it that way also. We are also recommending strongly to our clients that they draft up an FFCRA paid leave policy, not to be put in handbooks because this sunsets on December 31. And if you put it in your handbook now, you're going to have to pull it out on December 31 up from the handbook, but to have a separate standalone policy that you get out to your employees, because the poster only says so much, and your employees need to understand how this paid leave is going to work for them, what it means for them, and how it's going to be administered within your business. And so while the poster explains to them what their rights are, it doesn't necessarily explain the mechanics of the leave and what needs to be done. And so we are recommending to our clients that they, in addition to the poster, which is required, that they also have this policy in place that will explain to employees exactly how this leave is going to work for them, for both the 80 hours of paid leave and then the 12 weeks of expanded family medical leave. Okay, next question. I am still stuck trying to determine employee count. We normally have over 600. However, we have had a great deal of employees reduced to zero. We're in the restaurant industry. We certainly have less than 500 actively working right now, but we did not permanently lay off anyone. Do employees at 0 hours count in the 500? I'm trying to determine if our employees actively working are covered. My understanding for purposes of counting the employees, you do a head count each time an employee makes a request for leave. You do a different count to determine how many employees you have. And employees not working don't count for purposes of determining head count for whether you are over or under that 500, or you're under or at or above the 500 employee threshold. And so all employees actively working count. Full-time employees, part-time employees count as one. Joint employees, that is employees that are working for you you're a joint employer with someone else, day laborers, temps, and all count in this calculation of whether or not you are under 500 or at or over 500, but they have to actually be working. So I would say if somebody has been reduced to 0 hours, whether you call it a furlough or not, they are on furlough right now. They have no scheduled hours. They are not an active employee. And so I would say that for purposes of whether you are over or under 500, they are not employees. And I would think that would bring you under the 500 employee threshold that would require compliance. It's certainly also the safest way to go. I understand it does create certain cost and administrative burdens by now being subject to this act, but it's certainly the safer way to go. To the extent that's not abundantly clear whether someone at zero is furloughed, even if you don't call it a furlough, if they're still on payroll just as a zero hour employee. But I think that that company is under 500 and is subject to the provisions of the act. If an employer is claiming the healthcare exemption, do they still have to post the poster? Yes, you do, because technically the exemption goes to the employee, not the employer. So it allows the employer to exempt employees who are healthcare providers or first responders. And the way the DOL is interpreting it, it's going to apply to all employees of an employer who are healthcare providers, right? But having said that, the exemption, as I read the statute specifically, goes to the employee, not the employer. So you are still a covered employer required to make the posting. You just aren't, you just might not have any covered employees. And so it's kind of weird. It's also unclear how the DOL is going to enforce this, how vigilant they're going to be. I doubt they're going to be going from workplace to workplace, but it certainly doesn't stop a particularly pissed off or vigilant employee from calling the DOL and saying, you know, I work for this healthcare provider and they don't have the poster up. Can a healthcare provider still provide FFCRA provisions if they want? Absolutely. This statute is a floor, it's not a ceiling. An employer is always free to do more for its employees, including deciding that employees who otherwise might be exempt are not exempt. Again, I'm going to find the exact language the DOL uses. The DOL right in the Q&A, didn't mean to block my face, right in the Q&A, it says the DOL, quote, encourages employers to be judicious when using this definition, referring to healthcare provider, to exempt healthcare providers from the provisions of the FFCRA, right? Encourages employers to be judicious, to certainly free to do more for employees in the statute says you have to do. And that applies to anything. You can say, even though these employees are healthcare providers under the statute and we can deem them exempt, we are going to provide to them the full umbrella of benefits that they would otherwise be entitled to under the Act. You can say, for any employer, you can say, we think 80 hours of paid sick leave is great, a great benefit that the federal government's providing or having us provide to employees. We are going to give 160 hours of paid sick leave, or we're going to give 240 hours of paid sick leave, or whatever. This act is a ceiling, or rather is a floor. It's not a ceiling. And any business, certainly a business with 500 or more employees can say, we are going to provide 80 hours of paid sick leave for our workers consistent with the act and this expanded family medical leave. You can do whatever you want. The only thing you can't do if you are under 500 employees is not comply with what the Act says you have to comply with. So as long as you're meeting that minimal requirement under the Act, you are certainly free to go above and beyond for your employees. And I'm encouraging companies to be as flexible, as compassionate, and as generous under the circumstances that their financial situation allows them to be. This is difficult for everybody, and particularly your employees who don't necessarily know whether they're going to have a job today, tomorrow, next week, or next month. So to the extent we can do things for our employees to make their lives easier without jeopardizing our ability as a business to provide for all of our employees, because it's going to force us to go out of business, then I'm encouraging businesses to do what they can here to soften the blow for employees. If a business is exempt, do they still have to give the poster? That's a yes. What if they are closed because of the nature of their practice, such as orthodontics? In other words, in states that have closed non-essential businesses, if an orthodontist's office is deemed non-essential and closed, do you still have to provide the notice? The answer to that question is no. The Department of Labor has said in its FAQs that a business that is closed prior to April 1st does not have to comply. So you don't have to provide the sick leave, you don't have to provide the expanded family medical leave, and you don't have to provide the poster because you don't have any compliance obligations if you're not open for business come April 1st. And that could either be because you went out of business, in which case you have no employees, it doesn't matter. Matters, I didn't mean that to sound as cold as it came out. I mean, it matters, but from a compliance standpoint, you're not going to have any compliance obligations. If you are temporarily closed through a state shelter in place or non-essential business order, then per the DOL's interpretation, you have no compliance obligations here either. If we don't normally provide FMLA, does the expanded coverage in the FFCRA apply to us? Absolutely it does. So the FMLA, 50 or more employees is the coverage threshold, and I'm really simplifying that. So there's lots of employers with under 50 employees that have never had to comply with the FMLA before. Now you all do if you're under 50 employees, because the coverage threshold for the FFCRA is under 500. So if you are under 50, you certainly have new compliance obligations, which for the FMLA means you have to provide this expanded FMLA for school closures and child care related issues. It doesn't make you, it doesn't bind you to the FMLA's other leave requirements. So if you're under 50 employees, you still don't have to provide FMLA for an employee's serious health condition or a family member's serious health condition, or the birth of a child or the placement of a child for adoption, or for the military leave requirements. That still doesn't apply here. But the FFCRA's expanded family medical leave for school and child care related absences, that will apply to you, as will the 80 hours of, as does the 80 hours of paid sick leave. With regard to the small employer exemption, are employers under 50 employees automatically exempt from that as they are regular FMLA, or do we have to claim it as affecting the viability of the business? It's not automatic. You have to claim it. As I said earlier, an authorized officer of the business must make the determination that you fall into one of three categories, as the DOL is defining, jeopardizing the viability of the business. Either you're going to lose so much money that you can't operate, or you're going to lose one or more employees that are so key to your operations that you can't operate, or you're going to lose so many employees in the aggregate that you're not going to be able to meet minimal operational standards. You have to, some officer of the corporation or the business must make that determination that you fall into one of those three categories. Again, it's a self-determination, so you're not applying to the Department of Labor to make that determination for you. You are merely making the self-determination that you fall into one of those three categories, but it's not automatic, right? It is not every company under 50 employees is a small business that is exempt. It has to be this jeopardizing the viability of the business, and you must meet one of those three definitions. My biggest question is balancing all of this documentation / tracking of the leave with employee personal health info. What am I able to ask an employee to find out if it's COVID related or not for the tax exemption? That's a really, really, really good question. I will say that the EEOC has put out very, very good guidance in the last week to week and a half, where the EEOC has basically said, because this is now a pandemic and a national health emergency, a lot of the rules relating to medical confidentiality and medical exams under the ADA are kind of out the window right now, at least as they relate to coronavirus in the short term. And so you can, in figuring out why an employee might not be coming to work, you can ask if they have coronavirus. You can ask if they have coronavirus related symptoms. I mean, and there are public health reasons why you want to do that, separate and apart from just leave tracking. If you have an employee that's out with coronavirus, or is testing, or is awaiting test results, or has corona consistent symptoms, you want to know, because this virus lays dormant for 14, as much as 14 days or longer before anybody is symptomatic. You want to know who might have been a silent carrier or a silent transmitter before they're even sick, so that or before they ever exhibited symptoms. So you need to know who else in your business might have been exposed and might need to be quarantining as well, so we can maintain the appropriate quarantining and isolating to try and stop the spread further than what's already possibly spread, while people are these kind of silent vectors for the illness. So you certainly can ask these questions. In terms of leave tracking, the DOL has said a couple of things. Number one, the Treasury Department and the IRS has said they are going to put out further guidance on the information that employers should be gathering for purposes of proving that a leave of absence qualifies for the tax credit, number one. But the DOL has said, the type of documentation that you can gather is documentation like, notes from medical professionals, newspaper articles about school closures, letters from schools that they're closed, or from daycare or other child care providers that they're not open or not accepting children for the time being. Something that will document the specific coronavirus, the relation between the absence and the coronavirus itself. If an employer closes prior to April 1, its employees are not eligible for paid family leave or sick leave. Employers that close after April 1 are only required to pay employees for family or sick leave taken under the Act through the date of closure. DeWine's stay-at-home started before April 1. We closed due to his order as non-essential. Does that mean that my staff doesn't qualify for the 2 weeks of sick leave, even if he extends his stay-at-home further into April? If you are closed and out of business right now, or you're temporarily shut down, you're not operational, then my interpretation of that is, yes, you are not operational, you are shut down, you're not, and you are not required to comply. Separately from that, a state, as we've seen, the state shelter in place and stay-at-home orders right now, in and of themselves aren't qualifying for paid sick leave under the Act. The Act mentions federal, state, or local quarantine or isolation orders. I don't think anybody so far that I've seen has interpreted these state stay-at-home or shelter-in-place orders as a governmental quarantine or isolation order that would qualify someone for this 80 hours of paid sick leave. And so if you are shut as of April 1 or whatever, if you're not in Ohio, whatever date your state shelter-in-place order went into place, and are remaining shuttered for the foreseeable future because you are a non-essential business, then my interpretation of the FFCRA is that you don't have compliance. You don't have compliance obligations. Thank you for all who are sending in updates on your HRIS and payroll providers, who all seem to be saying that this will all be updated by Wednesday to help track. Someone shrugged, and I agree. I mean, we'll have to wait and see what this looks like if and when this, if and when this rolls out. If a company furloughs after an employee has been approved for the expanded leave, the employee is still protected, correct? Also, does paid sick leave run concurrent for the first 10 days? If a company furloughs after an employee has been approved for the expanded leave, if they're not working, they're not working. And so I don't think you have payment obligations to an employee or paid sick leave obligations to an employee on furlough. You would have to pay them for the leave they took prior to being put on furlough. But once they're on furlough and not, or late or on layoff status, you don't have obligations to them relative to their to your paid leave obligations. I would caution you, however, that there are anti-discrimination and retaliation provisions built into the statute. And if you are only, for example, laying off or furloughing those workers who maybe are exercising their rights under the statute, that you might have a discrimination or retaliation issue. As I look ahead down the road, 6 months, 9 months, 12 months, I think we're going to see a lot of those type claims. I'm going to see a lot of those type claims that my clients are going to be getting for discrimination and retaliation under this statute. I would just caution you to make your decisions on independent and non-discriminatory business reasons, and not target those employees who are using paid sick leave or paid leave under the statute. Are those affected by shelter-in-place orders allowed to take paid sick leave or expanded FMLA? As I said a minute ago, my read and just about everyone else's read of the statute is no. No, they can't. Do you have a policy template you can share? My clients that I have been drafting and billing for policies would be very upset if I shared it with everybody That said, I am happy to have a conversation with folks offline if you want to see about building a policy for your business. Can any portion of the leave be used intermittently? For example, if two parents are splitting time with the kids, can someone use a partial day? That's an open issue right now. The Department of Labor has said that leave can be used intermittently, but it has to be agreed upon by the employer and the employee. So it's up to the employer to allow that. It's not, on the face of its statute, it's not automatic. So it has to be done with employer approval, but it is certainly something that employers can do for their employees under the statute, make this leave available on an intermittent basis. Let's see. If a salaried employee takes intermittent leave, does the FLSA influence whether or not we still pay them for a full day's work? Under the Fair Labor Standards Act, there are certain very limited circumstances in which you can not pay a salaried employee for a full day's work. Intermittent FMLA is one of them. So you can actually deduct intermittent leave from an employee's intermittent FMLA from an employee's salary. I will say that those exceptions, I don't believe, cover paid sick leave under the FFCRA. They may or they may not. It's unclear. I've also gotten a lot of questions from clients about furloughs and how we handle furloughs for salaried or reducing salaried employees' hours. For a salaried worker, the minute a salaried worker works 1 minute in a work week, they are due and owed their entire salary. So if you have someone who earns $1,000 a week in a salary, if they work minute one, they're due and owed that entire $1,000 for that week. If you need to reduce hours of salaried workers, that is, you're cutting all your staff back by, let's say, 40%. Everyone's only going to work at 60% capacity. If you want to make sure that you're only paying that salaried worker $600 for the 60% of work that they're doing, rather than just cutting their hours back, you need to actually do a salary reduction for that worker, such that you're going to cut their salary rather than cut their hours, you cut their salary. And you're going to end up in the same place, but from a compliance standpoint under the Fair Labor Standards Act, you want to make sure that you do this right so you're not on the hook for the entire salary. And I'd also caution you, because the salary threshold is now higher for under the salary test for the exemption under the Fair Labor Standards Act, you just want to make sure that you are not inadvertently causing a salary exempt worker to be non-exempt by dropping their salary below that threshold. Although if you're cutting hours, maybe they're not working more than 40 hours in a week now, so it might be a difference without a distinction or whatever. If someone has been tested already and tested positive and the health department says they are eligible to come back April 1, but this person is still coughing, can we have them retested? You can certainly require fitness for duty or other negative tests before someone comes back to work. You don't have to let them come back to work. At least in Ohio, tests are very hard to come by, so you might not be able to get a retest. We are recommending 72 hours fever-free, without fever and symptom-free, without any medication, 72 hours of improving symptoms, and at least 7 days since symptoms started. That's the current, at least in Ohio, that's what the state shelter-in-place order requires of employees before they're allowed to return to work. But if someone was positive and is still coughing, you don't have to allow them. Certainly don't have to allow them back to work. How does the FFCRA interact with paid leave in state law? Thinking of New York in particular, but I have people in many states. I have no idea. And I don't mean that as a punt, but I don't believe the Department of Labor has said yet, and it's still an open issue. We know that this law, the FFCRA, works in addition to paid leaves already available from an employer. So you can't use the 80 hours of leave that you can't use like 80 hours of paid sick leave in a policy and say, well, we already provide 80 hours of paid sick leave, so we don't have to provide the 80 hours under the FFCRA. That's not going to fly. It's an addition to, and I'm going to assume that you have a state law that makes paid leave available. These buckets of paid leave under this federal statute are also going to be in addition to, but it's not an issue that I haven't seen specific guidance from yet. Does a stay-at-home order or advisory, like the ones put in place by the governors of Massachusetts and New Hampshire, qualify as a reason for paid sick leave under the Families First Act? I don't believe it does. As I said earlier, the state isolation or quarantine orders, because they're not these state stay-at-home orders, rather, because they're not requiring people to be quarantined or isolated. We can still leave our homes to walk our dogs, to walk ourselves, to go to the grocery store, the pharmacy, to work for an essential business or what have you. We do not believe that those orders qualify for paid sick leave under the act. If the company is closed to the public and provides no sales or services and only the executives are working, is this considered closed? I think it would still be open. However, if an employee is not working, they have no hours, I don't believe the employee is eligible for this paid sick leave under the act. And therefore, even though the business might be open, only those people that are actively working hours and providing services are the ones that can claim claim entitlements under this statute. If an employee receives pay under the sick pay or FMLA provision of the law, can we deduct regular benefit premiums from their pay, or do they owe them when they return to regular pay structure? That's up to each individual business to decide, and I've seen businesses do it any number of ways. I've seen businesses pick up the entire premium themselves, which is extraordinarily generous right now. I've seen businesses just continue with employee contributions as normal with deductions out of paychecks. I've seen businesses give these as essentially as loans to employees, saying we're going to figure it out when you come back, and then the business can either collect that from employees when they come back to work full time, or just write the loan off. I've seen it done. I've seen it done any number of ways. We have employees that are requesting to be laid off now. We're a warehouse that is an essential business. Should we make them wait until Wednesday? That's up to you. You don't have to wait till Wednesday. You can lay them off now if they want to be laid off. They'll be eligible for unemployment. If you have work to be done, my suggestion is that you have enough employees to get the work done and deny layoff requests unless you have to make them. If you have to make the layoffs, then so be it. But my fear, and it's kind of a perverse incentive in the CARES Act, the $2 trillion stimulus package, is that because you've now added $600 onto employees' unemployment benefits that they're eligible to collect, that you have created kind of a perverse incentive for employees not to work because unemployment benefits are so high right now. And so my fear is that employers are going to have a rush of people just volunteering for layoff status or frankly quitting their jobs related to coronavirus, which is in turn going to cause, I think, real staffing issues for businesses moving forward. But no requirement that you wait till 4/1. If you need to lay off, you can certainly lay off now. How do I calculate a server's pay at the 2/3 rate? Do I give them their normal hourly and estimated tip wage, or just their hourly? I believe it's their normal hourly plus their estimated tips. It's kind of what they would have earned had they been working is the way it's supposed to be calculated. So for a tipped worker, that would be their reduced hourly wage plus their tip wages, what they would have earned had they been working. Please mention what qualifies for child care provider. So thank you. And this is a question that came in, I think, via email or on LinkedIn, one or the other, before we started today. And this is the last question I'm going to take, and then I'm going to turn it over to my daughter, who said she needs about 30 seconds. So she's going to go, and then she's going to come back. She's going to do a song for everybody if you want to hang out for a few minutes. What qualifies as a child care provider? A child care provider, it must be someone who's in the business of providing childcare. It can't be someone's grandma who watches the kids, even on a regular basis, who now can't watch the kids because she doesn't want to be around people. She's under her own kind of self-quarantine. That doesn't qualify. The child care provider in the statute that has to be unavailable for an employee to qualify for leave under the Act is a professional child care provider, someone that is paid money for their services for watching kids. That's their business. Not a friend, not a relative, not the neighbor down the street, not grandma, not grandpa, not aunt or uncle or whoever else. It is a paid child care provider. It could be a daycare center. Maybe a neighbor runs a daycare center in their home, but you pay them for that service, right? It is someone that receives compensation for their, and thank you, Kelsey, who just typed the actual definition, right? So center-based child care provider, group home child care provider, a family child care provider that is one who provides child care services as the sole caregiver in a private residence, other licensed provider of child care, on and on and on and on and on. So, okay, are employees eligible for paid leave due to child care closure, even though they have the option to work remotely? The answer to that question is no. If someone can work remotely, then they are not, if they can telework, they are not unavailable to work. And with that, I really think I'm gonna sit, you wanna close that so you don't get like light behind you? I'm gonna turn it over to, everybody say hi to Nora. This is Nora. Nora is 13. Someone last time requested that my daughter come in. I'm guitarist in another band called Social Cues. We've been playing music now for more than what are you gonna play for everybody?
It's called Good Times, and it's by my band.
Which band?
Fake ID.
And where can they hear Good Times?
On SoundCloud.
Okay. Everybody know how is going to play Good Times, and so take it away, Nora.
Goodbye, farewell. It's been a good ride with you. You couldn't tell.
We can't hear you. Uh-oh.
That's not good.
That is not good. Why can't they hear? Can people hear? Oh, they can. I'm sorry.
Oh,
all right, now she's going to start over. Okay.
Start over?
Start over.
Goodbye, farewell. It's been a good ride for you. You couldn't tell. So many years in the blink of an eye. I need someone to clarify what's going on in my mind. What's going on in my mind? I think that they were good times, good times, good times. I need you now, 'cause it hurts, oh it hurts when I think about you. The lights alone in your house, and it makes my stomach churn when I see it. I want to knock on your door. Will you please open it for me? I'm sorry. I'm sorry, but I do it anyway. I think that they were good times, good times, good times. I need you now, 'cause it hurts, oh it hurts I'll meet you there sometime soon. I think that you're good times, good times, good times. I need you now, 'cause it hurts, oh it hurts when I think about you. I think that you are good times, they were so good times. I need you now, 'cause it hurts, oh it hurts when I think about you.
Thank you, Nora. Thank you, everybody, for joining today. I apologize for the technical difficulties at the beginning. We'll do this again now that I kind of have that all figured out. We'll do this again probably in a week or so and update everybody. Thank you, everybody, for joining today, for your thoughtful questions, for your supreme patience as I worked through the awfulness at the beginning of the presentation, which I will now go back and edit out before I post this up online for people to view the recording of it. Everybody be well, be safe, and be kind. Thank you all very much.